What's up, everybody? Welcome back to my channel. My name is Amy, and this is Super Mama Amy. I am glad you spared time. As you all know, by now, all episodes in this channel are special. uh And in this special episode, sorry, we'll be talking about nipples, nipples, nipple issues. By now, I am expecting that you've watched the Breastfeeding 101 video. If you have not, please go and watch because it will put you at perspective at where we are. And also, I'm expecting that you've watched foods that help produce more milk, part one and part two. So nipple issues are basically issues that people somehow misconceptualize and say that these are issues that are shit. Of course, they come with breastfeeding, in the process of breastfeeding, in the challenges of breastfeeding, because by now breastfeeding is not easy. It's not easy as people assume it to be. So with the challenges of breastfeeding, with the expectations of breastfeeding, with the baby's little mouth failing to attach well, with the baby not concentrating when you require them to, with the baby sleeping all the time and you require them to breastfeed, things could happen to the breast and the nipples that cause it pain here and there, challenges here and there. And I'm sure by now you've heard, if you're close to mothers, you've heard them complain and say, hey, nipple ikipasuka. Yes, mama, expect. But should it happen, maybe you're already through it, your nipples look like they are bleeding, some blood is coming out, and you are just wondering, is this normal? Is this okay? Is this right? By the way, I have found I've compiled some information from my own story, from my own experience, and from the experiences of others, and of course by consulting a medic here to just to bring one and two, just to bring you to perspective to get to understand. First, I must congratulate you that you've chosen to breastfeed. It's an honor. It's a privilege. Share with me in the comment section how that is going. Okay? Share with me how that is going. Please tell us. Share with the other mamas here. Tell us how that is going. Tell us the challenges you might be facing. Tell us, especially now that you're talking about nipple issues, if you already have these issues. Okay? So, welcome on board. Number one nipple issue is latch pain, pain in latching pain, pain in latching. And this happens when baby, the first time maybe you're struggling, the very first moments of starting to breastfeed, you put baby on the nipple and they have not held it well, or challenges like that, they will possibly not hold it well. And if you want to know how to latch well, there is that information in breastfeeding 101. I think point one or two is just an explanation of how to latch well. Ensure you watch that video. And so in those challenges, baby could fail to latch well, and then it causes some pain. This pain should not worry you. To take away your breast or to remove your nipple, it is normal. Mama is telling you, Super Mama is telling you, it is normal. Expect some pain. It is latching pain. What you do to encourage the child to open their mouth wide so they latch better, you rub your nipple at this part. You see, this part of their, not your own now. Your own, it will not be possible. Baby's nose. I'm talking about baby's nose. Yeah, as they're looking at you crying and not concentrating, you rub your nipple here. Yeah, it will encourage them to open their mouth wide because they are thinking the nyonyo is on this side. And you've refused, obviously, to tell me what you call nyonyo. So I will accept and move on. So you rub your nipple on this part of their nose. It will encourage them to open their mouth wide. And as they open their mouth wide, of course, now you can put the nyonyo the right way. Please watch that video on Breastfeeding 101 so you know what I mean when I say the right way. Okay, that is number one issue. And it happens, expect it, mothers, expect it to happen. Mama has told you, expect it to happen. My own daughter used to open such a small mouth. Small mouth, small like this. Her mouth is already small, but she opens just a portion of it, so the nipple would sneak in. Like you are sneaking the nipple in. And this worked, rubbing the nipple on the nose here encouraged her to open her mouth wide. Today, she opens her mouth well. And you could also just add some few words like open your mouth, or fungua mdomo, fungua mdomo. What I tell my children is, open your mouth, we are leaving. Who wants to be left behind? Even children understand that when people are leaving, you don't stay behind. So open your mouth, we are leaving. And she would open her mouth wide because we are leaving. You could add some words. Fungua mdomo mama, fungua mdomo tamu, fungua mdomo nyonyo. Like add some words of encouragement as you do that. It will help ease the pain for you as mama, and baby obviously will breastfeed better. Okay? Number two, and this one you must have heard about it. This is like the most dreaded, the most feared, the most, I think it has pain unimaginable, Super Mama. But not to worry. Super Mama Amy has information on what you could do about it. It's called cracked. You had cracked nipples. Yes, Mama, yes. In the process of breastfeeding and the struggles, you could get your nipples cracked. Again, all this, like I've said, are issues of attachment. It's not that producing milk and giving it to your child has caused your nipples to crack. No, there are issues of attachment. So don't stop breastfeeding because your nipples will be cracked. Don't choose not to. Don't stop either. When your nipples get cracked, this is how you'll know. It is painful, obviously. It is painful. And hey, God forbid, they crack and then they go through the process of blood clotting. And then that black, is it the black mesh kind of something forms. Normal process of healing when you are cut. Hey, and then baby has to breastfeed after that black thing has come. Woo! 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 The pain. I had it when I had my first baby. By the way, I'll talk about the only things which I've had. Yes, there are more. There are very many issues that would come with breastfeeding. But I'm telling you, this particular one, I did have it. I remember screaming, and you want to give your baby the breast to suck, and you can't. You dread when baby starts pulling like this. You scream because it is painful. It is painful, Mama. We don't ignore. But myself, I was in a place where people are not patient with you. They're like, nyonyesha mtoto, watch a story. Watch a siasa. Yeah. And it's painful. But don't worry. Super Mama Amy is telling you she acknowledges your pain. I understand it is painful. It is painful. We cannot argue about that. I am sorry. Sometimes it even starts being bloody. Yes, some blood could be coming out of it. And you're thinking, should I keep breastfeeding? Is this normal? Is blood supposed to come out of my nipple? Am I supposed to be feeling this pain? No, you are not. You're not supposed to be feeling those things. Those are challenges that come with latching. And sometimes when it becomes infected, if you don't seek attention or you don't seek remedy quickly, it could start producing some discharge. Yeah, when it does that, please consult daktari. Yes, consult a medical practitioner or medical advice, because you also don't want to infect baby. Okay, you also don't want to infect baby. If the blood is coming out in small portions, of course by now I expect that you know your HIV status. Yes, super mamas, you should know your HIV status, because you also don't want to do what we call a mother to child uh, transfer. Is it transfer or transmission? Transmission. I know you know all those things. We will not get into the detail, but doctor will advise the remedies for this. Of course, because the main cause is poor latching, shallow latching. One remedy would be latch well, and I will refer you to Breastfeeding 101 so you know how to latch well. But just to share with you a little secret, the baby's mouth must be wide open. Wide open. More details of latching well are in that video, Breastfeeding 101 tips. It's called tips. This is Breastfeeding 102. So this one is called nipple issues, but Breastfeeding 101 has tips. You must ensure the areola, yes, the dark part, this black dark part of the breast. If the breast has a different color, maybe it's pink, but definitely the part which comes and then ends with the nipple. Most of it is in the baby's mouth. It will not choke her. It will not choke her or him. So don't be afraid, especially the upper side. Most of it should be in the mouth. And then positioning and stuff, watch that video to get that. Um, so just ensure one, you latch well. And two, if you latch well, you'll prevent cracked nipples. But should you have the cracked nipples already, I'll tell you what I did. It could also be because of the skin around that place is dry. So you might want to put some gel on it. Yeah, you after you realize it's cracked, you just clean it dry. Then you put some nursing ointment if you have access. But if you don't have, use gel. Just apply a little portion, not a lot. Just some portion, some small ointment or gel around the nipple. It could help just the way it helps with cracked lips. Yeah? Cracked lips, I'm sure you know cracked lips. Just the way it helps with cracked lips, apply some gel. Or you could do some warm sponge pressing with some warm sponge or towel just around that place to ease some pain, okay, on your breast, to ease some pain. But specifically, this worked for me. The gel worked for me, and I started expressing breast milk then. But this one is more of engorged breast, which I'll be talking about. But also just expressing helped remove that dark. You remember I was talking about the way normal processes of healing after your cut. There's this dark meshy like stuff that comes. This dark thing. Expressing helped me remove that dark thing gently, without pain. So I would express and express and express, and with time it was over. It came out, it was out completely, and then the nipples healed. I was afraid because we had been told in hospital, if you don't breastfeed well from one side completely, your nipple will have issues. So I thought it was that. No, it was not that. If you had that information, that nipple issue associated with not breastfeeding wholly is my number 3 nipple issue, and I'm going to explain it shortly. So if you have cracked nipples, just apply some gel on it. Yes, apply some gel. You could try pressing with some warm stuff, something, and then you could try expressing. But most importantly, ensure baby latches well. Okay? So number 3, this one is associated with not breastfeeding right. Watch Breastfeeding 101 to know what I mean when I say breastfeeding right. Okay, you have watched foods to increase milk production, so you have milk, but you do not know how to breastfeed well. You will still have issues. And then issue number 3 here, it's called engorged breasts. The breast bulges out, becomes bigger because it has a lot of milk. Baby is not feeding right. Baby is not draining the whole milk from one side of the brain. Or maybe you slept and no, the one for sleeping is not that one. But you're taking too long between feeds. it's taking too long between feeds. Yeah, you're not giving baby frequently as it should be. By the way, try and give baby at least every 2 hours. Let baby breastfeed unless they demand more. Sometimes it could be every hour, but at least every 2 hours. Ensure you are draining some milk from your breast. Either you give baby, just give baby. By the way, it is babies now. It is babies. If you take very long between feeds, if baby does not drain a whole breast before getting to another one, if baby does not breastfeed well, does not feed well, my friend, you will have engorged breasts. Some people say, ati, ay, niko na maziwa, niko na maziwa. No, it is a problem. This niko na maziwa, maziwa should be draining out for baby. Okay? So, it can become very painful when baby starts breastfeeding if you have engorged breasts. Solutions for that basically is if you realize they are bulging out and causing some pain, what you do is just before baby breastfeeds, you express some little. You could use your hand, you just press above the areola, or you could use a pump to pull out some little. Just pull out so it releases the pressure, because definitely if it's too much, if there's so much milk in the breast, pressure has mounted. So it releases some pressure, helps calm down. Yeah, so express a little, and then you could also try expressing after baby has fed and baby is asleep. Some babies sleep while breastfeeding. You can wake them up by tapping their feet or just hitting their bottoms. Not tough, not painfully, gently. It will wake them up, or hitting their chin like this. It will wake them up for those who sleep while breastfeeding. So when the breasts are engorged and baby has, you're sure they've had enough, but the milk is just too much, you could express. This is your time to maybe consider expressing and having your own stock or starch, stack, whatever. You can start expressing so that it gets out all the milk, from the breast. And I have done a video on expressing breast milk. Ensure you subscribe to watch it so you know the benefits. Expressing breast milk could help you prevent engorged breasts. Yeah. So uh, um try try expressing between feeds. If baby is not feeding as frequently, you want them to feed but they're just full and the milk is overflowing, express and maybe store. But maybe just to ease the pain that comes with it when baby starts feeding, when you have engorged breasts, you could just express a little before you give it to baby. It will not cause harm. Okay, it will not cause harm. So that is number 3. Number 4. Oh, before I go to number 4, again on engorged breasts, if you have an older child who is still a baby, like mine is 1 and 8 months old, he's still my baby. He's not 2, and I want him to have breast milk until he's 2. Although he has stopped to take it directly from Nyonyo, but should I express and put on a feeding bottle, he would still have it. So this is the time they come in handy. Yeah, because milk is a lot and little baby is not having it. This is the time an older child comes in to help you release that pressure. Okay, so don't be afraid that unanyonyesha watoto wawili. Ni wako. Ni wako, you mean? It's okay, it is safe. In fact, it is helping this other one, the older one, build immunity, and also ensuring that the brain keeps registering there is demand for milk here, so it produces more milk. You don't want milk to stop coming out after you've observed foods that increase breast milk, right? So keep the flow by expressing or giving it to an older child. If you do not have an older child, express and store. Okay? Another issue which affected me and I dread it most. If I hear you have it, hey, nakwambia tu pole. Pole, mama. These things are not to make you feel dread, to feel fear in you. These are to educate you so you know what to do to prevent them. Do you know what to do to prevent engorged breasts? Express milk. Don't let feeds don't take a lot of time between feeds. Okay, let baby finish a whole breast. Okay? Clogged breasts, clogged duct, sorry, is another problem which comes with nipples. This could happen because of so many things. You know, the way it's a common practice that when you breastfeed, you hold the breast like this, one finger up, the rest of the fingers down. You should support babies breastfeeding by holding the breast in case the breast is big or maybe things like that. You want to support baby because again, you don't want to leave the whole weight of the breast on baby's mouth. He or she will not latch well and you will have issues with cracked nipples and all the others. But as you support, dear mama, I want to tell you, hold the breast from down like this. Yes, don't press on top. Do not press on top. Pressing on top could cause clogged duct. And this my friend warned me about when I was breastfeeding one time. Yes, new mama, as a new mama, you want to hold it on top because that is what we see oftenly. It is wrong. It could cause clogged duct for you because you are pressing, you're holding back milk from above here. If you do that oftenly, that milk could decide to stay back there. And should something happen and the place where you are holding maybe solidifies or it decides to stay back there, that is what we call clogged duct. That clog will have to come out. Can you imagine the pain of having to pull that clog out? I feel sorry for you. In case you're going through it, it is not, it is painful. It is painful. I had it one time. Another cause could be when you sleep and you sleep on one breast so that milk is not coming out. And baby is not breastfeeding at night. Maybe you've devised a hack like the one I have in expressing breast milk. When that video comes up, please subscribe to ensure you watch it. Please subscribe. There's a lot in store. One time, I will share this in story of my life, definitely. I'm sure you've started watching. But one time, I had to sleep and lie on one breast. I woke up. It was firm and painful. This is how you know. It is so painful, firm. Umejua matiti imekauka hivi? Hehe. You can even have fever and fall sick because of clogged duct. Or you've had something hits you, probably accidental, definitely. Something hits you at at a spot on your breast and everything goes dark. I can imagine that pain. Mine was because I slept on the breast, but there are so many other causes. If this happens to you, super mama, or it's already happened to you, but again, I'm telling you, you could prevent this by being careful. Don't let things hit you. Don't lie on your breast unconsciously. Do not take too long between feeds. Okay? And as you breastfeed, don't press on top ati unataka maziwa itoke mingi. Maziwa will just flow as long as you are concentrating and baby is feeding. Have you noticed? Sometimes you might think you don't have milk in the breast, and then baby starts feeding and you feel like it's flowing. And it's a lot. It even starts flowing on this other side from which baby was not feeding. So don't be stressed about milk. I've told you foods to eat to ensure you have enough supply. Ensure you watch those videos. Don't press on top so that it flows in plenty. Okay? Should that happen to you, you will know because obviously it's tender, so painful to touch. Sometimes you even have fever or headache. If that happens, solution number one is you want baby to feed on that affected side. It will be painful because all that which has solidified that is preventing milk from coming, that is what we're calling a clog, has to come down. But it is doable. Please start with the side which is affected. Don't avoid all these things. Start with the side which is affected to breastfeed. It will pass. I'm telling you, it will pass. Okay? It will pass. But also, you could do some warm pressing with a towel, with a sponge. You do some warm pressing, some gentle massage on the breast because obviously it's painful. Some gentle massage to get the muscles around there to just relax and the duct to release that clog gently. Okay? Do some gentle massage on yourself. And gentle massage is good. Sometimes it could even help you track breast cancer early. I'm sure you know this information by now. How to check yourself, check self-checking for breast cancer. But just massage yourself. But also, most importantly, when this happens to you, if you're already in this, take rest. Take rest as much as it is possible. Resting enough helps you produce milk, but it would also just ensure the duct is open to release milk. Okay? If this happens. But if in case you've tried these home remedies and the pain is increasing, no solution, please ensure you talk to your doctor. Always consult with doctor. Are we together? Another thing that affects the breast super mamas is thrush. Yes, you notice your breast looking like it is turning red or pink, reddish. It is not really painful, but it has flecks, things like flecks on it. Flecks are those things. I know you've eaten KFC chicken. KFC spiced chicken has these two things you'd think zimefixwa on it. Not the spiceless one. The spiceless one is smooth. The spiced one has things you'd think zimefixwa like those two things. The things that look like that are called flakes. So you notice your nipple has some appearance of such. Don't be shocked. Don't be surprised. Of course, you have to be aware of what is happening to your body, but let it not scare everything out of you. I'm telling you to take it easy. It is just possibly that baby has mouth rash, and mouth rash just comes from breastfeeding. They have they have had a lot of milk and so many other things. We will study. We will have a video on infections to watch out for that catch little babies, that catch infants. This is why sometimes have you heard people say clean up baby's mouth? You can put some piece of cloth, clean of course, clean cloth, put in warm salty water and maybe just rub around baby's tongue, baby's mouth to just release extra milk to clean up the mouth. I've said piece of cloth in warm salty water. Make sure it is dry. It is no water in it because you don't want salty water to stay in baby's mouth so baby will be swallowing salty water. This is just to help clean the mouth. Yeah. And of course, these are my opinions. Again, no professional help. If you need consult, please consult a doctor if you have an issue with that. But once in a while, I'm sure you'll be advised to just clean baby's mouth so that it doesn't have yeast. Yes, yeast can catch baby's mouth. The yeast, you know. Do you know the yeast that catches women? Down there, down there. If you don't know, tell me in the comment section. So I plan to tell you. I plan to do. But anyway, yes, women have yeast down there. But I'm not talking about that yeast. I'm talking about yeast that catches babies in the mouth. It's called thrush as well. And as they breastfeed, this could be transferred to your nipple. Your little precious nipple could have thrush. It's the same thing. So as you wash baby's mouth, you too should try and wipe your nipple with warm, salty water. That is basically remedy number one. How will you know it's reddish, look like flecks? I don't know if there's some. I'm unsure about the pain, but I know this is most common if you don't wash your baby's mouth. Um, um Solutions for this, yeah, it's red and shiny. Solutions for this, number one, you might want to get antifungal cream from doctor or medication from doctor if you notice such a thing with you. But also just try to sterilize, like I've said, warm salty water you wipe on your nipple as you clean baby's mouth, because if you clean your nipple and baby's mouth is not clean, it will still reoccur. So you might want to sterilize, and also sterilize bottles, sterilize the pump, breast pump, if you're using pump to express milk, sterilize. And I've said you don't need to have, there are these machines, electronics, that help in sterilization of baby utensils. If you don't have those ones, I've said boil water, lots of it. You could add salt in it. Boil, as it's boiling, you throw in these baby utensils. This is why you should get good quality utensils, those that will not melt up with the water. You might also want to wash your bras properly and just add some hot water on the basin. So things like that, you could pour in some vinegar if you have access to vinegar. Vinegar would help to just kill any potential yeasts that might still be hovering around. Yeah. So these are just remedies. Ensure you observe again top level hygiene during baby's life. 0 to 28 days, very critical. Okay. Yes, so those are basically the things I'm calling nipple issues. I know there are so many. I have heard of inverted nipples, but I don't know if that is related to breastfeeding. You might want to talk to your doctor if anything feels unusual. Your maternal instincts, again, like I've said, should always be on top because you don't want to deny baby breast milk. Yeah, it. Some of them are painful. I've mentioned those that have affected me. Some of them are painful. If this happens to you, don't stress. You can consult doctor, but I've also shared some remedies which worked for me, which you could try at home. It's painful, we acknowledge, but sorry, mama. You know, mama. Welcome to the club. But it will not last forever. One thing is that it will not last forever. Your breast will not be cut. Oh, your nipple will not fall off. Just in case you are wondering, nipple haitaisha. Okay? These are just challenges that come. Ensure you latch well. You have full knowledge on breastfeeding. Okay? So I'm gonna have to leave it there. Thank you for your time. Please consider subscribing. If you're new here, if you're a subscriber, we appreciate. Please share with me your comment. Share this information with other mamas out there. Bye. See you in the next one.